Mkhize says COVID-19 situation in India is a concern for South Africa. First batch of Pfizer vaccines touched down at OR Tambo, and next generation vaccines could take the form of pills and nasal sprays. These are the top coronavirus headlines from this week. We at African News Agency have been tracking the critical moments for you, and we've wrapped it up in 3 minutes. Health Minister Zweli Mkhize said the COVID-19 situation in India and the increasing infections is a concern for South Africa. After several weeks of soaring infections, India reported more than 400,000 new cases on Saturday, a global record. The country has recorded over 19.6 million cases and 216,000 deaths. India is also experiencing an acute shortage of oxygen for the treatment of seriously ill COVID-19 patients. Speaking during a UNICEF online briefing on vaccine doses and distribution around the world, Mkhize said there is a risk that the dominant virus variant in India could be spread to South Africa.
You will also realize that South Africa and India have got very close historical and economic links, cultural links, and therefore our people tend to be moving between these countries. Therefore, the risk of the spread of the variant.
The first shipment of more than 325,000 Pfizer vaccines landed in South Africa on Sunday evening. The vaccines will be sent to the National Control Laboratory for quality assurance, and after release will be distributed to the various provinces. Mkhize said South Africa would be receiving around 300,000 vaccine doses on a weekly basis until the end of May, and this would be doubled from June. By the end of June, Mkhize says the country expects to have secured at least 4.5 million Pfizer vaccine doses. Meanwhile, the Sisonke vaccination program continues to roll out the Johnson & Johnson vaccine around the country at 95 vaccination sites. Healthcare workers have been urged to register for the vaccine as the study resumed last week Wednesday after it was temporarily paused. Leading vaccine manufacturers are working to develop the next generation of COVID-19 vaccines in the form of pills and nasal sprays. Pfizer has revealed that clinical trials for an oral antiviral pill are already underway. CEO Albert Bourla said the oral vaccines provide several advantages and could be a game changer. According to a company tracking the development of COVID-19 vaccines, Faster Cures, 5 companies are developing oral vaccines and 13 companies are developing a nasal spray vaccine. Scientists from biotechnology company Vaxart said the option of having an antiviral pill and nasal spray could be effective and would allow people to avoid injections they don't want to have. That's 3 minutes. Tune in next week for another roundup of the top coronavirus stories.